Since all the panel members are or have been academics, I declare that the rules of an academic faculty apply. That is to say, no physical contact. However, withering sarcasm, excruciating, condescending, and cross-questioning of fellow panel members is permitted. So let me begin with a naive question. In preparation for this panel, I've done far more reading than I had planned to on drug policy, and one of the things that I'm finding it hard to put my finger on is we have the metaphor of the drug war, but what is it we're fighting? Are we fighting criminals who use drugs? Are we fighting a contagion that is spread by toxins rather than viruses? What is it that the drug war is addressed to? Anyone who wants to begin there can.
Yeah, all right. Well, thank you, and thank you for allowing me to be here before the Federalist Society, a great organization here and throughout the country. I think that's changing. I think part of the confusion is a confusion that's involved with change that's fostered by a better understanding. I think the old view, I mean, look, I suspect, like most Americans, everyone in this room has either had a family member or a friend who suffered from substance abuse. You know what it's like, you know how it changes them, you know how difficult it is, you know how painful it is. And you also know people, and there undoubtedly are people in this room who are in recovery from it, that we can treat this and overcome it. The old view was that it was a character flaw or a weakness or a sin or a personal failure of some kind. You couldn't hold your liquor, you couldn't have the strength of character not to succumb to these things. What we have learned is it's a disease. It's a disease that any of us can catch. Any of you can be an alcoholic or a drug addict. If you take these substances, take them enough times, close enough frequency, we can make any human being. We can make any rat or monkey a drug addict, and we do for research. It's a biological phenomenon. Now, it's one that does start with choice and not a virus you catch in the air on the subway. But it's also one we can discourage. We've had drug use go down quite dramatically as well as go up in our history. And it's something, as I say, we know how to treat. These are peculiar substances in that they cause the phenomenon on people is to have their life and their freedom shrink down if they become addictive and dependent to seeking and consuming the substance and destroying their life and relationships. But again, it is something that we know how to treat. So I think we're learning to both try to stop the supply better. We can talk about that since it's about enforcement. But I do think that what we're doing is trying to balance control of access to these poisons and the marketing of these poisons and the consequences of those who are exposed to them. And so we've learned that you can't just do one thing. Everybody wants to find the one thing they can do, just prevention, just interdiction, just treatment, and administrations at the beginning flounder around with trying to figure out, okay, what's the simple answer that we can drive policy behind? And I think the simple answer is you have to have balance. You have to reduce the supply and demand to keep it down, and to get it down and keep it down.
If I could just say a word about this, it will perhaps surprise you to hear that I am in violent agreement with Mr. Walters. And before I go any further, I just want to make one observation, and that is, as I look across this room, I see that there really is something fundamentally wrong with Washington, D.C., and that is the weather. But leaving that aside, in one sentence, I would say we are fighting apathy, we are fighting neglect, we are fighting disease, and we are fighting irresponsibility. And I think that is consistent with what's been laid out, because a problem can be a problem about disease, it can be a medical problem, but it can still be a problem that fundamentally involves personal choice and personal responsibility, in as much as it involves choices people make in their lives. It involves the extent to which people decide to ignore or not to ignore the problems that their fellow citizens have. It involves the extent to which people are willing to look at the consequences of actions and inaction in a community, and the extent to which people are willing to look hard at what has worked and what has not worked. And sometimes those are painful choices. Things that sound good in the abstract may not work in practice. And as we think about what we're fighting, I think it's also important to recognize that this is an enormously complicated, enormously costly, enormously painful and difficult problem. It has been so for generations. I would like to think it will not be by the time my daughter grows up, but the fact is we'll probably still be at this. And yet, despite the fact that this has taken generations, it's extremely important not to fall into the trap of assuming that nothing has worked. What do I mean? Parents taking responsibility for their kids and the role that they play. Drug use declining, actually, among teenagers over the last few years, in part because of efforts that have been made across administrations. Bipartisan support for ideas that seem to be working. Some ideas don't work, others do work. I'd mentioned drug courts, I'd mentioned in-prison drug treatment. These are ideas that have been supported by people like Chuck Grassley, Senator Brownback. Improvements at the VA in terms of taking care of our veterans and making sure we better integrate drug treatment with overall medical care. So all of this is not to say that the fight is going to be over anytime soon, or that we shouldn't ask really hard questions about exactly what we should be fighting, but it is to say that it's wrong to assume that we're not making some progress.
The actual question was about the term war on terror, and neither the two national policymakers had any reference to that term, because apparently implicitly they accept the term, and I don't. Well, the problem is the whole term is not only the war on drugs, it's the war on crime, it's the war on terror. War, that's the problem. That term invented by some PR person to give a short soundbite that the media can handle sends us off in the wrong direction. A war is an international defensive operation against an identifiable enemy. We're talking with crime, with drugs, with terror, with an abstraction. And it sets us up for failure. Why? Because Americans win wars, right? We get impatient when we don't win the war. And of course, we want unconditional surrender. This is a war you can't win. I don't mean it can't be reduced. What I mean is that you can't eliminate totally drug use. You can't eliminate crime completely. When you set it up in this way, you also do other things. Instead of police measures, it's war. And of course, there are no limits many times in war. When you set it up as war, you confuse the role of police in international matters. And this is where we don't make distinctions. And when they talk about complexity, yes, it's complex, but they've confused the whole thing. They've confused it because any solution in Washington has to centralize. Because if you're in Washington, the whole world out there beyond the Beltway looks confusing and disordered. I'm not questioning motives. I'm questioning institutional capability. That is, it is actually grounded in the structure of our Constitution that certain things can be well done at the national level and many things simply cannot be. There are certain very important things that the federal government should be doing, is attempting to do, and is in large part failed at. Therefore, they go and do other things in order to take credit for the money that they're spending. The role of the federal government is interdiction, primarily. It's the third of the three things listed in the last Bush report on this. Interdiction means controlling international borders and dealing with across state line borders. That is the essence of what the federal law enforcement role ought to be. It goes to another point. There's a difference between, quote, regulating commerce and punishing crime. The business about punishing crime is a moral judgment. It's what I used to do as a state prosecutor at the local level. There's a big gap between what prosecutors and defense attorneys do down in the crummy courts of major cities versus what policy wonks do in Washington. There's a very big difference, and oftentimes it is simply the money from Washington that drives particular things at the local level, often not for the best of reasons, but simply because you can get the money. I'm not saying that there isn't an important federal role. There is an important federal role. But what has been left out is the reality that much of this has to be done at the local level, not just with prosecutors, and Mr. Cuéllar mentioned family involvement. Ultimately, what we're talking about, to the extent that you want to look at it as, quote, public health, it's not really public health. It's about family health, community health. The federal government can only make things not worse. That's the best they can do. Thank you.